I came to the addictions program because I needed a provider who would absolutely not prescribe controlled substances. I do have an addiction to prescription medications, and I've abused things that doctors will tell me is not addictive. It was important to me to find a provider who I could trust that would not offer anything that would change the way I felt, anything that I would be attracted to abusing. I wanted recovery, I wanted sobriety, and I wanted to be clean, and I yet needed to take care of my mental health. The medications were important to maintain stability with mental health. Even though I would say, listen, I'm a prescription addict, please do not prescribe anything that would change the way I feel, whether it's controlled or not. Please do not offer it to me. You'll catch me in a moment that I'm more vulnerable, and I'll accept that prescription, which happened and caused relapse. I had to work very hard to find the physicians and the therapists that I needed who could treat addiction. So I did a lot of research, found the providers here at the Med Center, and the Med Center willing to work with someone who was struggling to get the services.
Substance use disorder is not a character flaw. It's not a weakness. It's not just not being able to say no. It's a medical disorder that requires medical treatment. And most people are unable, once they have substance use disorder, are unable to stop without the help that comes from a specialized treatment program. Our program is real specialized in that we have psychiatry in our program as well as addiction medicine combined, and so we're treating co-occurring disorders. The purpose is to help people recover from substance use disorders through therapy, psychosocial interventions, psychotherapeutic interventions, as well as through medication management for substance use disorders and medication management for psychiatric disorders. We really do cover dual diagnosis in co-occurring disorders. So we're treating a holistic approach to our patients, where we're covering substance use disorders, but we're also treating and covering the mental health disorders as well, and the psychiatric disorders with psychiatrists and addiction medicine specialists. Oftentimes what's happened in the past is that they've gone at their substance use disorder with just a psychotherapeutic intervention, focusing primarily on the substance use disorder without covering the second part of it, which is the mental health concerns. And it's really well known that if you have a patient who has substance use disorders and a mental health condition, if you don't treat one, the other one doesn't get better. We work really hard to surround folks with the treatment that they need at the different levels that we have available.
I have felt like I found an answer here. I found a therapist who not only listened and validated my feelings and supported me, but also gave me answers and worked me. Someone who gave me and taught me skills to use, that I go into my prescriber with the comfort that I'm supported in this, and my prescriber understands the DBT skills that I use, understands the 12-step program that I work, has a good understanding of recovery in a way that doesn't involve medications. I've never gotten the skills and the work and been in a place to stop therapy in over 20 years, and this program has definitely helped bring me to this point. I brought myself to this point as well, and I've recommended Nebraska Medicine therapy and psychiatry to others who are looking.